Magandang araw sa inyong lahat. My name is Jeffley Reboron and welcome to our first pre-recorded class for the subject Theoretical Foundations in Nursing. You have to remember that as nurses who are still starting your journey in your academic life as future carers of the profession, you have to build a theoretical base or foundation to demonstrate the knowledge about the science and art of the profession of nursing so that you will be able to promote health and wellness for your patients, whether the patient is an individual, a family, or the community or the society. Now, you have to remember also that nursing theory can help us to identify the focus, the means, and the goals of the nursing practice. So, it's very important for us to, as nurses, to understand the theoretical foundations of nursing so that we will be able to understand what nursing is and what it is not, so that we can also help other people in our community to have a better understanding of the unique things that we do for our patients. Now, the first thing that you have to learn in our subject, Theoretical Foundations of Nursing, is the history of nursing. Now, marahil nagtataka kayo kung bakit kailangan pa nating pag-aralan ang nakaraan ng ating profesyon or disiplina. Now, there is always a beauty at looking at the past because it helps us fully understand and celebrate the present and also the future. Now, you have to remember that as nursing students, there is a need for you to study the history of nursing theory for you to fully understand why and how it became a science and an art. Kasi ang nursing naman po, hindi siya dumating dito sa Pilipinas na immediately naging science and art na siya eh. It is because of the things that have happened in the past, a culmination of the happenstances in our history that made nursing a combination of science and an art. And yun yung isa nating pag-aaralan in the theoretical foundations of nursing. Now, as mentioned, nursing is as varied as the people who practice it and is dynamic and diverse as a kaleidoscope of ethnic, cultural, and religious manifestations of people who receive nursing care. You have to remember that nurses come from different walks of life and they come in different shapes, sizes, forms, and colors. People in the nursing profession have different creed, different social status, gender orientation, religion, and etc. And this diversity of the people's backgrounds and characteristics makes their expression of care different and individualized from one another. Ibig sabihin, kahit na pareho tayong Filipino nurses, because of what has happened in our past and because of our training, our experiences, the people that we meet in our lifetime, magkakaiba po yung expression natin of care because of our characteristics that make us unique, thus making our nursing care also unique. But you have to remember that all nursing acts, even though they are different when it comes to expression, even though they are individualized, all nursing acts are geared towards realizing and restoring the patient's bio-psycho-spiritual well-being. And it is always geared towards assisting the client to live a happy, a healthy, and a normal life. So, ang ibig sabihin niyan is that even though I told you a while ago that nursing has different expressions of care because of the people practicing our profession, and although we have different expressions of the way we care for patients, our goal still remains the same, and that is to promote, to restore, and to preserve the health of our patients, be it individual, the family, or society. So dun po tayo nagkakaparehas even though we have different backgrounds. Our nursing acts are always geared towards the promotion, the restoration, and the preservation of health. Now, palagi nyo din tatandaan that there is no exact classification of nursing theory in each time, place, and setting. Anong ibig sabihin po nito? our nurse theorists and nurse thinkers in the past have different idea or classification of what nursing is. So si Roy, si Rogers, si Orem, si Nightingale, and even Watson have different idea and definition of what nursing is, and they view nursing as different. So each generation, each era, they have different view or perspective of what nursing theory is. So it has been very flexible yung ating idea or definition of what nursing is. Kaya nga po, minsan, even us nurses don't really understand what the meaning of our profession is. How we are different from other caring professions. Like for example, yung mga medtechs, pharmacists, doctors, mga ganong tipo. It's very hard for us to find a niche wherein we can truly say that this is the unique thing that we do. So, paiba-iba po kasi ng mga meaning and categories or classifications of nursing theory depending on the time, the place, and the setting. So, depende po kung nasaan ka nagpa-practice ng nursing mo, nursing as a profession is also viewed differently. Now, it is always important to note that nursing theorists, regardless of their orientation, they have already tried to shed light to the unique way of nursing. Now, anong ibig sabihin nito? There are nurse theorists in the past who have sought ways to represent the realities and relationships that are found within our nursing practice. Anong ibig sabihin nito? Most of them, even though they are practicing nursing, don't really understand what nursing really is and what did they do during their lifetime. They tried to create theories that are representative of what their view or perspective of the job that they do is. Okay? So theories were developed to enhance the practice of nursing either directly or by stimulating practice-based thinking through reflection or indirectly through further development of theory. Ito yung mga ginagawa po ng ating mga nurse theorists in the past. They have tried to define what nursing is. They tried to clarify the real meaning of the caring profession by directly or indirectly contributing to the wealth of knowledge in nursing. Now, marahil ay naiisip nyo na ano ba yan? Yung nursing profession namin, wala pa siyang ganong definite na definition. Now, that has been true for the past couple of decades. Nahihirapan tayo as nurses to find our true calling, our true roles and responsibilities. Kasi nga, pag sinabi nating nurses, ay nagbibigay yan ng gamot. But what makes us different from pharmacists? What makes us different from doctors who also give medications? Ay, yung mga nurses, nagbibigay yan ng mga knowledge para tayo ay ma-promote ang ating mga health at ma-prevent ang mga sickness. But what makes us different from midwives who also do health education? Yung mga nurses, sila po yung mga nag-i-insert ng mga IV or tumitingin ng mga laboratory tests. Now, what makes us different from medical technologists? So, I hope you understand what I am getting at. That for the longest time, we have had a difficult time delineating what nursing is and what it is not. And we are very thankful that we have nurse theorists in the past who have already paved the way for us to understand what nursing is because of the theories that they have presented and accomplished over time. Now, we Filipinos, as a unique nation and race, we have our own interpretation of nursing, both as an art and as a science. And it can be said also that Filipino nurses do practice a unique form of nursing that is attuned with the Filipino spirit and culture. Now, kaya nga po sobrang mabenta ng mga Filipino nurses around the globe because it has something to do with the way we express our care to the patients. Di ba nagtataka kayo na ang dami namang nurses sa US, ang dami namang nurses sa Canada, but why are they seeking the care that is only given by Filipino nurses? Like I said, because it has something to do with our creed, it has something to do with the way we practice our profession. Marahil ito ay dahil sa ating close family ties with our mothers and fathers and other significant relatives. Marahil ito ay dahil sa poverty na naranasan natin in the Philippines. That's the reason why we have been very caring towards other people. Those are the reasons why Filipino nurses are sought after in other countries because we have a special way of caring for the patients. Now, let us look at the history of how nursing started in the Philippines. During the American period, Filipino nurses, during the American period in the Philippines, I should say, Filipino women were given the chance to become educated as nurses. And they were guided by American nurses and even missionary mentors. So may mga priests then and other nurses from America that have taught these Filipino women the way of nursing. Until nursing became a full-fledged profession in the Philippines, and it became a professional career not only for the modern-day women in the country but also for men. So actually, a nursing profession started as a profession for Filipino women. But it is because of the progressive thinking of Filipino people, the acceptance of gender in our country, that other genders and other sexes also are coming into our nursing profession. However, even though we were trained by American mentors, American nurses and priests, even though they were the ones who gave us the idea, the knowledge, and the skills of what nursing is, we Filipinos have integrated our own belief system, our practices, and our traditions in our expression of care. And that is why they say that Filipino nurses are very marketable around the world. Kung mapapansin nyo, ang daming mga nurses na nagta-thrive at nagsusurvive at they are making a living in the different countries around the world because of their profession, because people love the way we express our care. And like I said, it has something to do with our beliefs as Filipinos, our practices, and our traditions, and the way we were brought up by our parents and in the different generations that we had. Now let's look at the different reasons why nursing is considered a science. Now, it is said that nursing is a melting pot of the different knowledge, creeds, and backgrounds of care and healing that has been collected and preserved since the dawn of time. Anong ibig sabihin po nito? Nursing is considered as a science because, as a profession, we use a plethora of knowledge that are heavily based on hard facts and soft sciences. Anong ibig sabihin nito? We have borrowed several knowledge and skills from different professions that are scientific, and we have integrated it as our own knowledge. So ibig sabihin niyan, as nurses, we borrowed our knowledge from medicine. We also borrowed some of our knowledge from pharmacology, from psychology. Naghiram din tayo ng mga knowledge natin from physical and respiratory therapy, rehabilitation therapy and occupational therapy, and even education. So, lagi niyong tatandaan po na nursing is a science because we are a collection of different practices, of knowledges that have been collected by other disciplines since the nick of time. So, bakit natin sinabi na meron tayong knowledge when it comes to medicine? Kasi nga po, we also know how to do diagnosis. Even though we have different nursing diagnosis at mga doktor lang talaga ang pwedeng magsabi kung anong sakit mo, for us nurses, we are also able to do our own nursing diagnosis. So, isa yan sa mga pinag-aralan natin at hiniram sa medisina. Aside from that, we also have borrowed knowledge from pharmacology. Mga nurses, we are sometimes able to advise patients on what supplements to give, and sometimes you have a very big knowledge or a horizon filled with knowledge on pharmacology. Bakit? Kasi minsan, pag mga doctor sila yung nagbibigay ng mga orders ng doctors, as a nurse, you have to know the different functions, contraindications, side effects, mechanisms of action ng mga gamot na prescribe ng doctor so that you can question the safety of the medication being prescribed. So dapat din, kahit na yung doctor lang ang pwedeng mag-prescribe, we also have to have a knowledge on pharmacology so that we can question the decisions of our doctors so that we can better protect the safety of our patient. So makita nyo po, no, na we have borrowed several knowledge from different health and allied professions and even outside of our profession. Magkakaroon din po kayo ng mga experiences going to the community wherein you will be trained by your teachers on how to properly do health teaching, mother's class, children's class, or yung mga discharge instructions sa ating mga patients. So, ibig sabihin nito, we have also borrowed some of the concepts of learning and teaching from education na ini-incorporate natin sa ating profession. So, what am I getting at? Basically, what I am saying is that nursing is a mix of all professions. Marami po tayong mga skills up our sleeves and there are so many knowledge that we have gained over time that we can use in our disposal. And we also use research and critical thinking in our work, which basically makes nursing a science. Now, it is very important and vital for nursing students like you to achieve a simple and a working knowledge of the concepts that make up a nursing theory, because I know for a fact that once you are able to understand the different theoretical foundations of nursing, you will take to heart your profession. Ibig sabihin, mas maganda po yung inyong expression of care if you have some nursing theories to anchor your perspectives to. Now, since it is also highly dynamic and it undergoes change or evolution, as new discoveries are made and informations are renewed from time to time, that is also one of the reasons why nursing is also seen as a science. Nursing is a science because the fundamentals of nursing practice consists of using scientific information of human beings in their mutual processes with their environment in order to provide the well-being of patients. Anong ibig sabihin po nito? We use these scientific foundations, okay, scientific information to care for our patients. Alam natin through science that at 37.8 degrees centigrade na temperature ng patient is already a sign of fever and that there may be an infection happening inside the body of a patient. We use that as a part of our knowledge. Ginagamit din po natin yung scientific information that the normal fetal heart tone is 120 to 160 and that a deviation of that is already considered abnormal. More than 160 beats per minute or less than 120 beats per minute, abnormal na po yun para sa ating pasyente and that they may be predisposed to having fetal distress or reflex relaxation of the anal sphincter that may lead to meconium aspiration syndrome. I know for a fact that these are big words that you are listening to, and I know that I might not be making sense as of the moment because you're still starting your journey in your nursing profession. However, gusto ko lang maintindihan nyo that we are using scientific information, numbers, mga different signs and symptoms sa ating mga pasyente for us to properly do our job well. So, ibig sabihin, nursing is a science because we use scientific data to care for our patients. Aside from that, we also consider nursing as a science because we also use scientific research to improve our praxis, to improve the way we care for our patients. Talaga sir? Nagre-research ang mga nurses? Yes, we do research because that is how we improve our procedures, our nursing practice. Our procedures have changed over time. May mga bagay po na ginagawa namin before na hindi na po namin ginagawa ngayon because of research. Because it has been found out by scientific evidence na yung mga practice na ginagawa namin before can do more harm than it can do good. Now, a good example of that is the use of sponge bath. nung ako po ay bata at ako po ay laging linalagnat, ang ginagawa po ng nanay ko before is naglalagay siya ng alcohol sa isang tub ng mainit na tubig. And that what is, they rub on my skin pag ako ay nagkakaroon ng fever. Now, it has been found out in research na pag kayo ay gumamit ng hot water sa pagtepid sponge bath or sa pagpaligo sa mga patient na meron ng fever, that will increase their temperature even more, thereby aggravating the fever. And it has also been found out in research na pag gumagamit tayo ng alcohol, ay lalong iinit yung surface area ng pasyente, thereby aggravating their fever. So, because of research, na-improve natin yung practice natin of tepid sponge bath in decreasing the temperature of our patients. So, anong ginagamit natin ngayon? Instead of alcohol and hot water, ang ginagamit na natin ngayon is water na sometimes cold. Tapos, pinepress lang po natin siya. We do not rub it anymore because it has also been found out na rubbing the skin of a patient with fever can also increase heat because of friction. Kaya ang ginagawa natin ngayon is parang dampi-dampi na lamang po. And that is a good example of how science has improved the nursing practice. Therefore, nursing can also be considered as a science. Aside from that, noong ako ay estudyante pa in the year 2003, hindi ko alam kung pinanganak na kayo before, pero noong 2003, we were trained to use mercurial thermometers. So, ang ginagamit namin noon is mga thermometer na kailangan pa namin i-shake, and then itatapat namin sa aming mga mata because the mercury will react to the heat. So, yun po yung magsasabi kung ano yung temperature ng patients. Now, it has also been found out by scientific research, na yung mga pasyente na binibigyan namin ng mercurial thermometers, pag sila ay may fever, there is a possibility na mag-convulsion sila. And when they do convulsions, nagsisisor yung patient, pwede nilang makagat yung thermometers na yon. At once na nakagat nila yung thermometer na yon, the mercury can seep out of that thermometer, which can cause mercury poisoning to the patient. So because of research, we changed the way we take the temperature of our patients. From using mercurial thermometer, gumagamit na kayo ngayon ng digital thermometer. So kahit makagat yan ng pasyente, hindi magkakaroon ng mercury poisoning. So again, that is a big example of how nursing science is done or improved through research. Now, let us understand what the real meaning of theory is. When we talk about theory, it is an organized system of accepted knowledge that is composed of concepts, propositions, definitions, and assumptions that are intended to explain a set of facts, events, or even a phenomena. Now, Chin and Kramer defined theory as a creative and rigorous structuring of ideas that projects tentative, purposeful, and systematic view of the phenomenon. And this definition also tries to explain the tentativeness of a theory. Lagi niyo pong tatandaan that theories are not actually facts. They are just accepted explanation to explain a phenomenon. So anong ibig sabihin nito? These theories are as good as they are. But once another theory comes in, or once another data comes in that disproves that theory, then the theory is already rejected. Kaya nga po tentative ang mga theory natin because they are as good as they get. Kung habang wala pang magandang explanation yung isang bagay, they're there, they're accepted, but once we have new evidence disproving that theory, then that theory is already rejected. Okay, I'll give you an example. We have the theory of how humans came to be. Alright, so meron tayong theory ni Charles Darwin, which is the evolution theory. Ang sinasabi niya is that humans come from apes. But I don't think na I come from an ape. But still, I digress. Sabi ni Charles Darwin, because of our evolution, the changes that we have undergone from eons, yung mga ancestors natin na unggoy, they learn to walk, and then since hindi na nila ginagamit yung kanilang mga tail to swing from tree to tree, ay lumiliit din ito ng lumiliit. That's the reason why they say that humans came from apes. However, we also have another theory, which is the theory of creation. Yes, sa mga diehard Catholics dyan, the creation is also a theory. Alright? So, anong ibig sabihin nito? We have theorized that there is an all-knowing being called God, and that God has created light on the first day, and then after that, He created the sun and moon, the sea and sky, and then the land, and then after that, yung mga animals in the sky and sea, and then on the sixth day, He created man and woman. So yun po yung parang theory din natin of how humans came to be. Now, like I said a while ago, a theory is supposed to explain a phenomenon. And a theory, even if it explains a phenomenon, once a new data comes in, the theory can either be proven or disproven. So, since we don't have any time machine yet, and since we can't go back to the past wherein makikita natin that God really created Adam and Eve, the theory of creation still stands. Alright? Kasi nga po, we have no way of disproving that theory. Therefore, it still stands. Wala din po tayong time machine that can go back to the past so that we are able to look at how humans really came from apes. However, there are already archaeologists that have dug up bones of Neanderthals and other apes who can prove, which can be used as a proof that men really came from apes. So again, the theory still stands. They are still accepted because there have been no data discovered yet to disprove these theories. But ano yung gusto kong sabihin sa inyo? That theories are tentative and that they can be proven or disproven. Again, marahil nagtataka kayo kung bakit kailangan yung pag-aralan ang nursing theories. Okay? You have to remember that theories are vital. They are important because they guide and give meaning to what we see. Now, when a researcher investigates and collects information through observation, the investigator needs a clear idea of what information is important to collect. Kaya nga po kailangan nating pag-aralan ang mga theories so that when you become researchers someday, you are able to understand what really are the factors that are part of that theory para alam natin yung mga variables that we are going to collect in the future. Now, that also goes to show that theories are valid because they are validated by research and they are sound basis for practical action. Lagi niyong tatandaan that theories are based on scientific data and that we can use these theories to guide our nursing praxis. Let's take for example, Florence Nightingale. Si Florence Nightingale po, meron siyang theory called the environment theory. According to Florence Nightingale, yung isang tao na may sakit, if you place him on a healthy environment, okay, that sick person will become healthy. However, according to the environment theory ni Florence Nightingale, a healthy person, when placed on an unhealthy environment, that person will become unhealthy. Yun po yung isang basis ng ating nursing practice. Majority of the things that we do, not just in our community but also in the hospital, are based on the environmental theory of Florence Nightingale. Kaya nga po, pag pumunta kayo sa hospital, there are hospitals, especially private hospitals, which makes the hospitals very clean. Napakakaaya-aya. And when nurses go to the community for their job, isa sa mga nagiging areas of concern ng mga nurses is the environmental sanitation, kung gaano kalinis yung ating mga community. Because we believe, according to the environment theory, that when we clean the environment, we create a healthy population. So, very important po na mapag-aralan nyo din kung ano ang mga nursing theories, because this can also help you guide your expression of care and your nursing praxis in the future. Now, aside from that, we need to understand what theories are, because they provide concepts to name and they provide names of the concepts that we see and also explain the different relationships between these concepts. So mapag-aaralan na natin yan mamaya, yung mga different na relationships ng mga concepts, kung anong tawag natin doon. So that will be part of our discussion later on. Aside from that, you have to remember that learning theory allows us to explain what we see, and we will also figure out the solutions that are needed for the problems that we see. So, ibig sabihin yan, pag meron tayong deeper understanding of what nursing theory is, mas mabusisis tayo sa paghahanap or pagtitingin kung ano yung cause ng problem. And because of the knowledge that we have regarding these theories, we will also be able to find a solution to the problem. So, like I said, gagamitin natin ang mga theory to anchor our expressions of care. Aside from that, theory is an important thing that you nursing students should learn, because theories are tools that enable us to identify a problem, and that will also help us to plan a means or a strategy for altering the situation. So, because of the theory, our knowledge of the nursing theories, we will be able to change the situation of our patients by integrating the propositions that are placed on the nursing research or theory, like nursing theory, I should say. These theories also help us understand the interconnectedness of the different concepts that affect each other. So, maimportante po talaga na mapag-aralan nyo what nursing theory is, so that we can all improve our nursing praxis and our expressions of care. Gaya ng sinabi ko kanina, in our class, we will be learning the different components of a theory. Now, it is important to note that a theory is composed of several concepts, definitions, and assumptions or propositions which can help us explain the phenomenon. And nurses are also able to direct and deliver caring nursing practices because of the foundations of knowledge that are set by these components. Anong ibig pong sabihin nito? You have to remember that when a phenomenon or a situation is very hard to grasp or to understand or explain because of the many underlying principles or variables or concepts that are connected with this phenomenon, it is best to understand the key players or the main concepts so we can better understand how they interact with one another. Now, these components of a theory can also help us organize and give meaning to the different facts and observations that we do. They also explain findings within context of existing knowledge, and we also get to have a better understanding of how things work based on that phenomenon. I'll give you an example. Pag-usapan natin yung psychoanalytical theory of Sigmund Freud. Now, pag tinatanong kayo ng isang pasyente or ng isang friend, for example, who are outside of the caring profession, pag tinanong nila, bakit nag-iiba-iba yung ugali ng isang tao? Or bakit we have different or unique behaviors or personalities? Ang pwede nating isagot dyan is the one theory that we have is the psychoanalytical theory of Sigmund Freud. Now, dito po kasi because of the theory that is presented by Sigmund Freud, because of the definitions he gave, because of the assumptions that he gave, we are already able to understand somehow why we have different or unique personalities. Nagbibigay si Sigmund Freud ngayon ng isang theory that will help us understand why we really have different personalities, unique personalities and behaviors. According to Sigmund Freud, sabi niya, that the behavior of a person is actually based on their sexual gratification across the lifespan. Ang sabi ni Sigmund Freud is that yung isang tao daw, pag siya ay infant, okay, siya ay nagiging selfish. Bakit? Because he is on his oral stage. Yung kanya pong sense of gratification or satisfaction is focused on its oral gratification. Kaya po yung isang bata, pag hindi siya nabibigyan ng dede, anong nangyayari? Umiiyak. So somehow, pag walang maibigay na bote yung nanay at hindi na nabigay yung gratification na hinahanap ng baby, siya ay umiiyak. Okay? The child doesn't say, ay, mamaturog ni mamang ko, mamaturog ni papang ko, masapul kong agtaltal na oray mabisinak. No! The child is very selfish during the oral stage. Okay? Punong-puno siya ng ego. Ang gusto niya, ako lang dapat. What my needs, my wants are, you should answer them. Okay? Give them to me. Kaya po yung bata, since yung kanyang gratification is in its oral stage, yung bata, kang walang dedeng maibigay, ang binibigay ng nanay sa kanya is pacifier para meron siyang hinangat-ngat. Kasi nga, yung gratification niya is solely based on the mouth. Kung wala naman, anong ginagawa ng bata? Nagta-thumbsuck siya. Tama? Nagta-thumbsuck siya because, again, oral stage is the center of gratification pag ikaw ay infant. Okay? That is one example of Sigmund Freud. And then, marami pa siyang mga different explanations kung yung mga behavior naman ng toddler, behavior ng schooler, ng preschooler, and even adolescent. So, sabi ni Sigmund Freud, nag-iiba-iba daw yung center of gratification from one life stage to another. So, pag infant ka, nasa oral stage ka. Pag ikaw naman ay toddler, nasa anal stage. Pag ikaw ay preschooler, nagiging phallic stage. And then pag schooler naman, nagiging latent. So, iba-iba yung explanation niya. Now, what am I trying to tell you? What I'm trying to tell you is that these concepts, these definitions na tinuturo ko ngayon, these assumptions are part of the theory of the psychoanalysis by Sigmund Freud. And it goes without saying na pag yung isang theory ay naintindihan natin yung mga concepts, definitions, assumptions, and propositions, how these variables interact with one another, we will be able to explain a phenomenon. In this case, we are explaining the behavior of a person using sexual gratification based on the theory of Sigmund Freud. Kaya nga po, maganda na pag-aralan natin ang mga different theories because it can help us understand the way things work. Okay? Now, you have to remember that once we understand the different components of the theory and how they interact with each other, they can be used as a basis for predicting future outcomes and observations, and they also can be served as a basis for us to design our nursing procedures and our expression of care. Okay, so sana po ay naintindihan nyo yung mga parts po na iyon. Like I said a while ago, we have different components of nursing theory. Lagi nyong tatandaan po na a phenomenon is somehow formed from concepts, from definitions, from assumptions, or propositions. In the same manner that a theory is also formed by a phenomenon, by the different assumptions, definitions, and concepts. So, lagi po nyong tatandaan that a theory has several components. Now, the first component of a theory is what we call a concept. What is a concept? It is defined as an idea formulated by the mind or an experience that is perceived or observed, such as justice, love, war, and disease. Now, it is important to note that concepts are the building blocks of theories, and that they are things that are being studied in theories, they are being compared to, and even related to one another. A concept is an abstraction that describes a portion of reality, and it is a general name for specific instances of a phenomenon that is being described. Now, marahil pwede din nating sabihin that a concept is an abstract notion. Or, simply put, it is a general idea or an understanding of something. It is an informal usage, and it is sometimes referred to as an idea that has a specific meaning, but in different fields, it also changes. A good example of that is a tree. Okay? Sabi natin kanina, concepts are mental images. Okay? In philosophy kasi, this mental image corresponds to distinct entities. Or in other words, it is an abstract idea that represents the basic characteristic of what it represents. So pag tinanong ko ngayon, what is a tree? You may have different understanding of what a tree looks like. Ay, yung tree sa amin kasi patusok. Pine trees. Yung tree sa amin kasi may mga bunga. Yung tree sa amin elongated upward. Yung tree sa amin pabilog. We have different mental image of what a tree looks like. But we all understand that to be the same. So, para sa atin, even though we have different ideas of what a tree looks like, we have a similar understanding of that. So yun po yung tinatawag natin na concept. Aside from that, maganda ding pag-usapan natin what success is, because sometimes that's a very interesting concept, the concept of success. Now when I ask you of your concept of what success is, marahil ay iba-iba yung magiging sagot ninyo kung ano ang meaning ng success para sa inyo. For others, it may be financial freedom, or, sir, wala kang utang, hindi mo kailangang magtrabaho para ikaw ay mag-survive. That is one definition of success. Maaari ding, ay sir, you are successful if you have a legacy to give to other people. Pag ikaw ay maraming lives na na-touch, at pag ikaw ay maraming mga buhay na nabago, then you can become successful. You can be called successful. Or, for example, you can be successful, sir, if you feel like you have been growing out of the shell that you have enveloped yourself into. Pag ikaw ay better version of your past self, then you are successful. Pwede din po yun. So like I said, we have different meanings or definitions of what success is. But basically, when you put these definitions of success together, what happens? You form a general idea, and that now becomes a clarified concept. Okay? So yung nakikita nyo ngayon is parang outline na siya of a theory of success. Okay? So ganun po yung mga concepts natin. It has several meanings, but again, the general idea remains the same. That is a concept. Pag-aralan naman po natin ngayon kung ano ang proposition, which is also another component of theories. When we speak of propositions, they explain the relationship of different concepts. Okay? Propositions contain two or more concepts that are connected using linking words or phrases that help them form a meaningful statement. And these propositions are statements explaining the logical linkage among certain concepts by asserting a universal connection between these different concepts. Okay? A good example of this proposition is when children do not want to stay in the hospital because of their fear of injection. So, ibig sabihin may propositions siya dyan na the stay in the hospital is affected by the degree of fear. So yung bata, pag mas mataas yung degree niya ng takot, mas mababa yung stay niya sa hospital or hindi siya magsistay sa hospital. But if the child is not afraid of doctors and nurses or needles, siya ay magsistay ng matagal sa hospital or the child will agree to hospitalization. So that is an example of a proposition. It already explains a relationship of the different concepts. In this case, ang pinag-aaralan natin is hospitalization and fear. So those are concepts that are linked by a proposition. So that you can better understand what propositions really are, let's go back to our previous example, which is the phenomenon of success. Now, sabi natin dito, di ba, that propositions are the ones that reflect the relationship between one concept from another concept. Balik po tayo sa phenomenon of success. Now, ibig pong sabihin niyan sa examples natin kanina that when a person has more financial freedom, that person has higher success. So, proposition po yun because it shows the link between the two. Another example, the more money the person has in a bank, the more the person is deemed to be successful. That is also another proposition. Another example, the more cars a person has, the more that is viewed as successful. Or, the more utang a person has, the more debts that he has, the more loans that he has, the more purita or the less successful the person is. So maraming utang ang person. So for the utang ang person, for the loans ang person, ibig sabihin for the not so successful ang person. So those are propositions. Another, if a person is magnanakaw, for example, siya ay politiko at maraming ninakaw na pera, okay? Even if a person has so many wealth, if that person gains that wealth from, for example, bad habits or bad practices, that person is not deemed successful. So, nakikita nyo yung propositions po, how these relationships of concepts are laid down. Okay? So, those are examples of propositions, or these are statements that help us understand how one concept is related to the other. Sana po ay mas naintindihan nyo by using the phenomenon of success. Another component of a theory is what we call definition. And we speak of definition, it is composed of various descriptions which convey a general meaning, and it reduces the vagueness in understanding a set of concepts. So ito pong definition na ito are the ones, or these are the statements that make the theory crystal clear. They are the ones which makes the theory more understandable to the readers. Now, the definition in theory provides us the explanation or clarification of what the concept is and what it is not. Simply put, the definition conveys the meaning of the theory so that it can work with clarity. Now, we have the term theoretical definition. Pag sinabi nating theoretical definition, they define a particular concept based on the theory's perspective. Okay? So, yung concept na yon, yung theory na yon, they are solely based on the theorist or the author doing that theory. Okay? Theoretical definition ang tawag natin doon. Now, when we speak of definitions, they are the things or the statements that define a term in an academic discipline, and they also define the functioning as a proposal to see a phenomenon in a certain way. A theoretical definition is a proposed way of thinking about potentially related events. Okay? And the definition is also well-substantiated explanation. Ito po ay isang explanation that is full of substance of an aspect or an explanation of a phenomenon, and it also provides us of a clearer view of what the theory really is pointing to. Now, a good example of this would be the definition of nursing that is formulated by Peplo, which is a significant and therapeutic interpersonal process. So pag-aaralan natin yung definition na ibinigay ni Peplo sa kanyang nursing theory. So dito po nyo maa-appreciate kung ano yung importance ng definition sa theory mismo by using the theory of Peplo. Gaya ng sinabi natin kanina, definitions are the things that or statements that make a theory more understandable because it gives a definition of what a thing is and what it is not. Ibig sabihin, it helps us understand what the theorist is trying to say, what the theorist's perspective is when it comes to that specific concept. Now, si Peplo po, si Hildegard Peplo, nagbigay siya ng kanyang own definition of nursing based on her theory of interpersonal relationships. Now, according to Peplo, she defined nursing as an interpersonal therapeutic process that takes place when professionals in the nursing profession, specifically the educated nurses, are engaging in therapeutic relationships with people who are in need of health services. Now, sinabi ni Hildegard Peplo na nagkakaroon daw po ng nursing, the phenomenon of nursing, kung yung isang nurse ay merong binibuild na interpersonal relationship with the patient. So, ibig sabihin po nito, pag yung according to Hildegard Peplo's definition of nursing, kung yung nurse daw ay nagbibigay lang ng gamot pero wala naman siyang nurse-patient interaction, nagche-check lang siya ng BP, nagte-take lang ng meds, nagcha-chart lang, inaalagaan niya tama yung pasyente. But there is no nurse-patient interaction. Wala man lang, hello ma'am, kamusta ka na po? Kamusta pong pakiramdam niyo? Wala man lang ganon. The nurse is acting like a robot. But still, even if the nurse is robotic in nature, kasi para siyang robot lang na yung mga dapat lang ginagawa niyang nursing procedures ang kanyang pine-perform, wala man lang touch of emotion, wala man lang touch of genuine caring sa kanyang ginagawa. According to Hildegard Peplo, we cannot say that that is nursing. Kasi even though the nurse is doing her job as a nurse, kung wala naman daw interpersonal relationship with the patient, then that is not considered nursing. So, again, definitions like this in a theory can help us understand the phenomenon. Okay? Ito yung mga definitions na ito ang nagbibigay sa atin ng understanding of how a theorist or a thinker understands the phenomenon. So, swerte tayo because we have already so many nurse theorists that have provided their own definition of what nursing is and what it is not. Now, we also talk about assumptions. When we say assumption, in theory, it is a statement that specifies the relationship or connection of factual concepts from different phenomenon. Now, assumptions are actually accepted as truths and are based on values and beliefs. Now, pag sinabi nating assumptions, these are statements that explain the nature of the concept, the definition, the purpose, and the relationship, and the whole structure of a theory. And when we say assumptions, they are ideas that we presume to be true. Kaya nga po siya assumera. Pag sinabi natin yung isang tao, pag siya ay ina-assume na yung isang bagay na kanyang iniisip ay tama. Okay? So, assumptions are ideas that we presume to be true and are used as a foundation of a theory. Okay? So, let me be clear about that. An assumption is something that you assume to be true or to be the case even without proof. Okay? A good example of this is we assume that all patients who are able to take good care of them, who are not able to take good care of themselves, need nurses. So inassume natin yon na lahat ng mga tao na nagkakasakit, na hindi kayang alagaan yung kanilang mga sarili, ay mangangailangan ng nurses. That is one assumption, that all sick individuals will need the help of a nurse. Assumera ka? Tama. Assumption ang tawag natin doon. Now, I will give you another example, a better example of as assumption in a nursing theory. And we will talk later about Orem's self-care deficit theory. Now, like I said kanina, that assumptions are statements that we think are true even if we don't have proof that they are. Okay? So, these are used as a basis for our theory. Now, makikita natin sa assumption ni Dorothea Orem na ito ang naging basis ng kanyang self-care deficit theory. Okay? So, ang assumption kasi ni Dorothea Orem is that kung yung isang tao daw ay nagkasakit, that person will not be able to take good care of himself. Kaya siya nagkakaroon ng self-care deficit, yung pasyente na yon. For example, kayo, di ba, pag nagkakasakit kayo, what you do basically is, natutulog lang, nakahiga lang, hindi na halos kayo kumakain ng mabuti, wala kayong ganang kumain, wala kayong ganang maligo, wala kayong ganang makipaglaro outside, mag-exercise, because you're sick. So, ang assumption ni Dorothea Orem is that all sick individuals will experience self-care deficit when they have sickness. Okay? So, yun yung assumption ni Dorothea Orem, na lahat ng mga taong nagkakasakit ay hindi nila kayang alagaan yung kanilang mga sarili. Sir, paano naman ako? Nagkakasakit naman ako, kaya ko naman ang alagaan ng sarili ko. Assumption nga, di ba? Assumption ni Dorothea Orem to. It is something that she believes to be the case. Alright? Now, according to Dorothea Orem, dito po daw pumapasok yung nursing. Meron din siyang sariling definition of nursing. And Dorothea Orem believes that if a person who is sick is not able to take good care of himself and the nurse fills in that deficit, pinupunan ng taong yon yung pagkukulang ng isang tao, then we can say that that is nursing. For example, ikaw ay nagkasakit. Hindi mo kaya mag-prepare ng iyong sariling pagkain, hindi mo kayang paliguan yung iyong sarili, hindi mo kayang bigyan ng gamot ang iyong sarili, at yung nanay mo, ginawa niya yun para sa'yo. According to Dorothea Orem's definition of nursing, yung pag-alaga sa'yo ng nanay mo can already be considered as a form of nursing. So nakita nyo, di ba, that these are the components of nursing theory. Meron kang concept. Dito sa case na to, ang concept ni Dorothea Orem is the self-care deficit. So meron siyang concept na nursing agency, deficit, self-care agency, self-care demands, yada, yada, yada. These are the concepts that are encapsulated in Dorothea Orem's theory. Okay? Meron din siyang mga lines na nakikita nyo. And these are the propositions. And then Dorothea Orem also has her assumption na lahat ng mga taong nagkakasakit will not be able to take good care of themselves. That's the reason why they will need nursing. And then Dorothea Orem also has her definition of these concepts along with nursing. Na pag meron daw tao na pumupuno sa deficit na yon, then that act is considered nursing. Okay, so sana po naintindihan nyo yung mga different components of a nursing theory. Or a theory, even a theory na from other disciplines, these are the same components po. Now, let us have a review of the different components of a theory. Sinabi natin kanina that a phenomenon describes an idea or responses about an event, a situation, a process, or a group of events or a group of situations. Meron din tayong pinag-usapan kanina which are concepts, which are mental images that helps describe or label a phenomenon. We also have definitions which are used to communicate the general meaning of the concepts of the theory. And we also have assumptions and propositions which helps explain the nature of the concepts, the different definitions, and the relationships and structures of a theory. So, tandaan nyo pong lahat ito because you might be given an activity later on in our course that you will have to create your own theory. So, dapat alamin nyo po yung mga different components of a theory so that you can create your own theory later on. Now, yaman din lamang na napag-uusapan na natin ang mga components of theories, let us also look at the different types of theories. And the first one is what we call descriptive theories, which are also known as factor isolating theories. Now, these theories are known to be primary level of theory development, meaning sila yung mga first level ng ating mga theories, and they identify and describe major concepts of phenomena. However, these descriptive theories or factor isolating theories, they do not explain the relationships of the concepts. So, hindi po sila nagbibigay ng relationships. Wala po silang propositions. Their main purpose is to present a phenomenon based on the five senses together with their corresponding meaning. A good example of this is the Big Bang Theory, which explains how the universe was formed. Wala pong propositions doon na the higher the Big Bang, the lesser, wala pong ganon. Okay? They just explain how the universe came to be. That is an example of a descriptive theory. The Big Bang Theory, ano pa? The evolution theory, or the theory of creation. They are just there to describe the phenomenon or explain the phenomenon. Another type of a theory is what we call the explanatory theory or the factor relating theories. Now, these types of theory present relationships among concepts and propositions. And these theories also aim to provide information on how or why concepts are related and how they are related with one another. Sometimes they give us an idea of the cause and effect relationships because of the explanatory theories. Now, they are multivariable constructs in nature and they are used to make sense of complex events and situations. A good example of this is the theory of use and misuse. Pag pinag-aralan natin yung theory of use and misuse, it explains the reason why some of our body parts are larger than the others. Okay? Pag yung isang tao kasi nag-gym, okay, the more daw, according to the use and misuse theory, the more a person goes to the gym and works his muscles, dahil sa nagagamit, lumalaki. Okay? Theory of use. However, pag yung isang tao naman daw ay hindi ginagamit yung kanyang muscle, lumiliit or nag-atrophize yung kanyang muscle, nagkakaroon ng atrophy yung kanyang muscle. So that is a theory of use and misuse. They explain the different factors that are related to a phenomenon. So dito po, this is the muscle growth. Sabi nila, the more exercise, the more muscle growth, the less exercise, the less muscle growth. So that is a good example of the explanatory theories. Another good example of that is why people love using iPhones. Yung iPhones napakamahal. Okay? Now, meron kasi tayong tinatawag na aspirational effect of an item. Okay? Pag yung isang item daw, hindi naman kahit hindi siya ganun kagandahan, but if other people who are prominent are using them, nagkakaroon siya ng aspirational value. Alright? So kung yung isang tao daw, na kunwari yung idol nyo na BTS, okay, BTS yung idol nyo, gumagamit sila ng iPhone, that iPhone, even though that is not a good phone, kunwari, even though that is not a good phone, since it is used by someone who you adore, yung phone na yon nagkakaroon siya ng aspirational value. Therefore, ikaw na nakakakita na ginagamit yun ng BTS, you would also like that phone for yourself. So again, that is another theory that explains the different factors why something sells more than the other. Okay, so those are examples of explanatory theories. They give propositions or relationships with one phenomenon or one concept to the other. Now we also have the third type of theory, which is called the predictive theory, which is also known as situation relating theory. Now, these theories are achieved when the relationships of concepts under a certain conditions are able to describe future outcomes consistently. Okay? And this kind of theory is also generated and tested using experimental research. A good example of this predictive theory na pwede nating gamitin is the theory of reflex relaxation of the anal sphincter pag kayo ay merong fetal distress. Okay, I'll explain this further para mas malaman natin kung ano ang predictive theory na ito. Now, meron kasing theory ang mga obstetricians explaining why these fetuses will pass on their meconium. Ang meconium kasi is the first stool, unang tae ng bata. Pag yung bata kasi, nandun siya sa loob ng sinapupunan at yung nanay ay nagle-labor. Alright? And pag yung bata ay tumae, thus the meconium mixes with the amniotic fluid. And that tae, which is mixed with the amniotic fluid, may be swallowed by the child. Okay? Pag pumasok po yung amniotic fluid na yon sa kanyang lungs, it can cause lung collapse. Pwedeng magkaroon ng respiratory distress yung bata dahil sa meron ngang meconium sa kanyang lungs. Alright? And that has been the problem by obstetricians and gynecologists since time immemorial. Now, nagkaroon sila ng theory which is the reflex relaxation of the anal sphincter. Ang sabi nila, na pag yung bata daw na nasa loob ng sinapupunan, bumaba yung kanyang oxygen level, that child will have a reflex relaxation of its anal sphincter. Ibig sabihin, yung kanyang anus, yung kanyang anus, yung nag-open at close para lumabas yung tae, nagre-relax daw yan pag yung bata ay mababa yung kanyang oxygen level. Okay? Now, that is the reason why if you get the fetal heart tone of the child, di ba nagle-labor si nanay, chinek mo yung kanyang FHT, less than 120 beats per minute or more than 120 beats per minute, sasabihin ng mga doktor, ay, mawawalan na yung pasyente, yung bata, ng oxygen. Magkakaroon siya ng low level of oxygen. Therefore, there is a possibility na yung bata na yan ay mag-reflex relaxation yung kanyang anal sphincter. So what will the doctors do? Because of that very low or very high FHT, na pre-predict nila na yung bata magkakaroon ng passage of meconium at maaring magkaroon siya ng fetal distress pag siya ay tumae. So hindi nahihintayin ng mga doktor na makatae pa yung bata. Once that they see that the FHT of the mother is dwindling, bumababa or tumataas ng sobra, what they do? Emergency CS po. I-emergency CS natin yung nanay para lumabas yung bata bago pa siya makatae so that we can prevent that child from getting respiratory distress. So that is an example of a predictive theory. We use the knowledge that we have so that we can plan for our actions later on. Another example of that is the theoretical model based on the observation of the effects of unsanitary environmental conditions on the recovery of post-operative patients. Example, yung isang pasyente na operahan, yung nanay na pinag-uusapan natin kanina, na operahan siya. And after that operation, yung nanay po, nilalagay natin sa post-anesthesia care unit or what we call PACU. Hindi PACU ha, PACU. Now, kunwari yung PACU is madumi. Madumi yung PACU na yon. Maraming langaw, maraming mga vomitus or nagsarwaan, maraming mga gamit doon na pakalat-kalat, and it's also not properly lit and it's not also properly ventilated. Using the theory of Florence Nightingale na environment theory, we can easily predict na yung tao na yon na nandun sa PACU na kaka-opera lang ay magkakaroon siya ng poor healing because of the unsanitary environment. So in that sense, nagiging predictive din yung theory ni Florence Nightingale na environment theory. Why? Because we can also already see the outcome of that patient based on the theory of Florence Nightingale na environment theory. So, sana po ay naintindihan nyo yung predictive theory na yon. Now, the last type of theory that we will be studying is what we call prescriptive theories, and they are also known as situation-producing theories. Now, when we speak of prescriptive theories, they deal with nursing actions, and they test the validity and certainty of a specific nursing intervention. Ang ibig sabihin nito, these prescriptive theories are the theories that give us an idea of what practices to keep and what practices to change, because they test the validity kung gaano pa siya ka-relevant or ka-valid yung mga ginagawa nating intervention. So these theories test our existing nursing practice. These kinds of theory are also commonly used in testing new nursing intervention. So ginagamit natin itong mga theories na ito so that we can come up with good practices na na-ensure natin that they are also safe for our patients. So again, we use these prescriptive theories to test new nursing interventions. And aside from that, these prescriptive theories are also often used when it comes to evidence-based nursing practice. So ito pong mga theory na ito usually are derived from existing and completed research studies. These prescriptive theories also address the nursing interventions for a phenomenon and also helps us guide practice change and also predict consequences. Now, sabi ko nga kanina, these theories help us to understand what things we need to incorporate in our nursing care. So, nai-improve natin yung ating mga expression of care, yung mga different nursing techniques natin, yung mga different nursing interventions and managements natin because of prescriptive theories that test the validity of these interventions. I'll give you an example. Balik ulit tayo sa PACU or the Post-Anesthesia Care Unit. Now, there is a theory that says that music can decrease post-operative pain in patients. Merong mga research study na nagsasabi that when they played classical music to patients who are in the post-anesthesia care unit, these patients who heard the classical music when they are recovering from anesthesia, they felt less pain compared to the people who were not given musical therapy or music therapy. So that is one prescriptive theory that we are already incorporating in our nursing practice. So ito pong mga prescriptive theories na to are the ones which proves or disproves a nursing intervention. Sila po yung nagsasabi if an intervention is worth keeping because of their advantages and benefits to the patient, to the nursing profession, and sila po yung mga nagsasabi na these practices are no longer safe. So prescriptive theories po ang tawag natin sa mga yon. And that ends my discussion for today. And I am so sorry for taking so much of your time. And I hope with all my heart that you learned something from me today. Thank you so much for listening, and I will see you on our next meeting. I will be posting an activity on our Google Classroom, so please keep posted. With that being said, this has been Jeffrey Reboron, and maraming salamat po sa inyo for listening. Have a good day and enjoy the rest of the day.